hypertension is going to be our focus and why we should pay keen attention to it. Joining us from Phytotech Limited, we have Dr. Reuben Tete Agbo. One more time, he joins us in the studio. Good to have you.
Thank you very much.
Why the focus on hypertension, though? I see, yes, we still have our Nitro MX here today, but why the focus on hypertension?
All right, okay, so before I start, I would want to say good morning to your cherished viewers and anybody at all who normally comes into contact with Phytotech Limited and their products. Now, this morning we are going to talk about hypertension. Why so? Because when you look at a lot of diseases that people are facing, especially when it comes to heart attack, heart failure, stroke, and other cardiovascular conditions, the major risk factor that causes all these things is hypertension. In fact, WHO in 2023 March reports estimates that 1.28 billion adults aged 30 to 79 years worldwide is having hypertension. And the funny, yes, 1.28 billion adults, so 30 to 79 years. And most of us are in our 30s, between 30s and 79.
That's about 13 to 15% of the global population.
Exactly, yes. And everybody is facing this particular challenge. And the funny thing is, 2/3 of this number, that is 1.28 billion, they are all living in low and middle income countries, including Ghana. So a lot of people are having this problem.
You see, we were just talking to youth and all that. If you don't have employment, you will likely, your pressure will go up.
Exactly.
If your light also goes off, your pressure will go up.
Exactly. And then, in fact, these days we are recording premature death a lot.
Yeah.
And one of the major things that are leading people into this death is hypertension, because it is a silent killer. Right from the beginning, in the early stages, you will not have any symptoms at all. So you can die from hypertension without you not knowing it. A lot of people are having...
So it's a silent killer?
Yes, it's a silent killer.
By the time you start seeing symptoms, it's already advanced?
Yes, you are done, yes.
Wow.
Yeah.
But tell me, though, a couple of times on the AM show, you've spoken about some of these activities.
Mm-hmm.
How then does poor blood circulation come into the fray, and then we talk about Nitro MX?
All right, so it is true that I have spoken about poor blood circulation many times, and I've made you to understand that if you are having poor blood circulation, most of your systems in the body is not able to function very well. Now, the question that Ben is asking me, now as to whether the poor blood circulation has a link with hypertension, yes, it is true. Poor blood circulation has a link with hypertension. If you're having poor blood circulation, you can have hypertension as well. How then does it happen? Now, we have something we call increased peripheral resistance. I'll break it into smaller pieces so that we'll all get to understand this. Now, we have peripheral resistance. You have your blood vessels line up in the system. Blood is able to flow very well, but this time you are having poor blood circulation. So now your blood vessels that are supposed to relax are not relaxed. Now they have narrowed or they have constricted. When it becomes constricted, now you have a backflow of blood in there that is not able to move very well. So you are creating more tension in the blood vessels. As you create more tension...
So more pressure is required to push the blood.
Exactly. And before you realize now you are having high blood pressure. That is what happens. Now, number two, if you are having impaired kidney function, so remember that most of the kidney diseases that we are having, most of them are coming due to hypertension. So if you're having, yes, those who are having the kidney failure and other stuff, most of them, the major cause of the kidney failure is because of hypertension. Now, how does it happen? Now, your blood vessels or your blood pressure is being regulated by the kidney as well. So the kidney regulates the volume of the blood, the kidney regulates the sodium in the blood, and then the kidney also regulates the water. So in doing this, they are regulating the blood pressure that you have. But if now you are not able to have enough blood entering into the kidney, it means that your kidney is not able to function well. Now, your kidneys are not able to function well. What then happens? It means that your blood pressure will now increase. So your poor blood circulation is now leading to hypertension as well. We also have endothelial dysfunction. Your endothelium is the inner lining of the blood vessels. Blood is able to flow very well. But this time, because blood, or you are having poor blood circulation, now your blood is not able to flow very well. So you have damaged the inner lining. So your blood vessels have become constricted or narrowed. In doing so, now you are having high blood pressure. So that is how poor blood circulation leads to hypertension.
Wow.
Yeah.
And enter Nitro MX.
Yes.
How then does this drug deal with blood circulation issues and, of course, by that way also impede hypertension and its concomitant, illnesses?
All right, okay. So we have a lot of people having high blood pressure, and then most often they would want to get medication so that they will be able to manage this. And most often too, they get medications all right, but some people are having resistant hypertension. It means that they have grown resistance to the medication that they are taking, and therefore they would want to opt for an alternative. What is the alternative? The alternative probably will be a herbal. Now, the herbal drug that they are going to take, is it going to help them? People would want to have a scientific, well-researched herbal drug that is going to help them. Now comes a Nitro-MS. That is how come we introduce the product Nitro-MS. Nitro-MS basically is supposed to relax the blood vessels. So Nitro-MS produces or helps the body to produce what we call nitric oxide. Now, this nitric oxide relaxes the blood vessels. Blood is able to flow very well. So if you are relaxing blood vessels, it means that you are not putting pressure on the heart to pump. So blood is able to flow very well. Now, you are also not having a lot of tension in the blood vessels. Therefore, it is bringing down the blood pressure to its normal levels. In fact, I have a woman as a patient who was having resistant hypertension, was taking medication for a very long time, and nothing was working. And this is a lot of challenges to a lot of people, and that is why we decided to do a studies on it. So I introduced Nitro-MS. I prescribed Nitro-MS to her, and then for 1 month, the blood pressure just came back to its optimum levels. We have done research on the nitric oxide or the Nitro-MS, and this is what we realized. Realized that we gave it to patients who are having resistant hypertension, first-time people who have developed hypertension as well. We gave it to them, and within 1 week of taking Nitro-MS, their systolic blood pressure, that is the first blood pressure that is being
so maybe what will be
written.
120 or something?
Yes, that 120, the first part. It's reduced by 13%. So those who are having like 175, it means that if it is reduced by 13%, you are getting somewhere like 140 thereabouts. And then it reduces the diastolic blood pressure, that is the lower parts, the lower number, by 5%. And we have done all the studies. The studies will be shown on the screen.
Okay,
and
so we have to go, but quick question.
Yeah.
People often are concerned. This is herbal, right?
Yes.
Can you take this in conjunction or together with other medications?
Oh, yes. You can take this one in conjunction with other medications as well. So what you do is, after you have taken your orthodox medication, you would have to wait for an hour or 2 hours.
Okay.
Yes, before you take this, so that you can prevent drug-herb interaction. So this is also going to help the other drug that we are taking in order to work faster for you. So you can actually take the Nitro-MS together with other medications as well. But if you are having any challenge, you just have to call us on the numbers that will be displayed on the screen. Then we can now show you how you can get how you can use the Nitro-MS together with the other antihypertensive medications that have been prescribed for you.
So finally, quickly, where can people get this? What number?
So any major pharmaceutical, retail or wholesale outlet out there, you can get Nitro-MS over there. So you go to Unicom, you go to East Cantonment Pharmacy, you go to Top Up Pharmacy, any pharmacy at our origin, you can get Nitro-MS over there. If you are having a challenge, you can call us on the numbers that have been displayed on the screen. I just want to mention it, 024 649 0116. 024 649 0116. When you call us, we'll be able to interact better with you, show you how best you can take the Nitro-MS in improving your blood circulation. Here lies the case in improving or bringing down your hypertension or high blood pressure. And if you are having resistant hypertension, also taking Nitro-MS in order to help you to manage it very well.
Doc, thank you so much for joining the conversation this morning. All right.